Good morning, everyone. I want to thank you all for joining us on Maternal Health Awareness Day. I think we've all had this on our calendar. Been exciting. I want to recognize our incredible legislative partners who are here with us today on the panel. We have our Senate Majority Leader, Teresa Ruiz, and Assemblywoman Shanique Spate. Outside of our very distinguished panel, I'd also like to welcome Assemblywoman Verlina Reynolds-Jackson. Is Assemblyman Varelli here? Did I miss him? Okay, then I won't give him a shout out. Just kidding. And Mayor Reed Gascura. Thanks, Reed. We are also joined today by a number of New Jersey's devoted faith leaders whose guidance and partnership and support of Nurture NJ has helped us reach thousands of moms and babies across the state. So I thank our faith leaders. Specifically, we've got Reverend Bartley, we've got Reverend Taylor, we've got First Lady Boyer, we've got Janine LaRue, Reverend Williams, Reverend Bolivar. We've got everybody here, I think. And for Reverend and First Lady Boyer, I want to say you have been on the ground here for years doing this here in Trenton, and we could not do anything without you. So God bless you, and thank you all. I clearly want to thank our incredible hosts, the Children's Home Society of New Jersey, so thank you so much for welcoming us here. When we first recognized Maternal Health Awareness Day 6 years ago, we launched Nurture NJ. That's our maternal and infant health initiative dedicated to solving our state's maternal health crisis. Each year since then, we've continued to make steady progress. Some of our landmark achievements include becoming the second state to expand Medicaid coverage 365 days postpartum, developing our maternal and infant health statewide strategic plan, establishing a first-of-its-kind government authority dedicated to maternal and infant health innovation, becoming the third state in the nation to ensure Medicaid coverage for doula care, and the first to require community doula training to get reimbursed, and the list goes on and on and on. To date, those achievements, in partnership with thousands across the state, have begun to move the needle, elevating New Jersey's maternal health ranking from 47th to 27th in the nation. But as you all know, we will not stop until we are ranked first. And today, I am thrilled to share another groundbreaking initiative, one which I am confident will propel us toward that goal: our universal nurse home visitation program known as Family Connects NJ. Fittingly, this program was officially launched on January 15th, Martin Luther King Jr. Day, a day our nation remembers the life, work, and message of one of our greatest leaders. Dr. King once delivered a sermon on Mother's Day. In it, he advised mothers of color to do three beautiful and essential things: teach their children self-respect, urge them to be the very best they can be, and recognize love as the only solution to humanity's problems. In that same sermon, however, Dr. King also pointed out that mothers of color were called to teach these lessons despite certain practical problems. I believe those practical problems are the very same ones at the heart of our maternal health crisis and are the direct result of systemic racism. And while we have made some progress since we began this work, it's important to remember that when this administration started, a black mother was nearly 7 times more likely than a white mother to die from pregnancy-related complications. And a Hispanic woman was more than 3.5 times more likely to die. A black baby was nearly 3 times more likely than a white baby to die before his or her first birthday, and a Hispanic baby 1.5 times. There can be no question that mothers need a wide range of support to ensure their families are thriving. They need safe housing, reliable transportation, nutritious food, good schools, excellent child care, consistent employment, and so much more. Which is why when our nurses visit new mothers, they are not only able to evaluate the health of the mother and the baby, they are also able to assess for other needs, nutrition assistance, lactation support, diapers, and more. By visiting mothers in their homes, barriers to getting support and relief, like funding childcare or transportation, are eliminated. And because clear communication and cultural competency are also essential to the success of this program, many of the nurses speak languages other than English. Further, the standard for postpartum evaluation of the mother is 6 weeks after delivery, which is completely unacceptable. If complications develop, and more than half of maternal deaths occur postpartum, they need to be identified and resolved immediately. Through this program, mothers will be seen by a nurse within 2 weeks of delivery, and they are able to receive up to 3 visits in total, ensuring thorough follow-up. This is literally how lives are going to be saved. Our racial disparities in outcomes exist regardless of income level or education. Therefore, this program is free for all new mothers and parents, including adoptive parents and those who experience the tragedy of stillbirth. This gives us the opportunity to support every new parent in the state. Currently, the program is available in Cumberland, Gloucester, Essex, Mercer, and Middlesex counties. But we will continue to roll out more counties, and eventually it will be available statewide. Families in those counties that are interested in a nurse visit can go today to familyconnectsnj.org to sign up. And while New Jersey is the second state to develop such a program, ours is absolutely the most robust. In fact, we are by far the largest and most diverse state to provide universal nurse home visitation, and we plan to make this program the gold standard for the entire nation. When we ensure that every new mom is healthy, safe, and secure, mothers are going to be able to do exactly what Dr. King asked in his sermon. This is how we build a state that puts mothers, babies, and families first. This is how we make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you. I am now excited to begin a discussion on our Universal Nurse Home Visitation Program, Family Connects NJ, in much greater detail with our incredible panelists. So please help me welcome, from Family Connects New Jersey, Mara Carrillo, a program support specialist. All right. Catherine Clemens, one of our incredible nurse home visitors. Grismeldi Gonzalez, a nurse manager. Also with us is our outstanding commissioner of the Department of Children and Families, Christine Norbert-Beyer. And 2 of our most dedicated legislative partners, Senate Majority Leaders Teresa Ruiz and Assemblywoman Shanique Spate, without whom we literally would have none of this. So thank you. Thank you all so much for the work you do on behalf of New Jersey's families and for your being here today. As we begin our discussion, please feel free to take a moment to give us a little bit more on your background and share any relevant information you might like. So we're going to get right at it. Our first question is going to be for Grismeldi Gonzalez. You were the lead nurse for the Family Connects Mercer County pilot. How has your experience been as a nurse home visitor since the start of the program, and what would you like to share with any moms who might be considering the program?
Thank you. Firstly, I want to thank everyone for being here today. I think it's really a testament to everyone's commitment here to reducing the maternal health disparities that we see in New Jersey today. I was actually one of the very first nurses hired for the pilot, which was carried out in Trenton. And it was very exciting being part of the pilot and helping to bring the program up from the ground, literally, writing all the policies and how we were going to carry out these home visits, even how we were going to schedule everything. I think our input as nurses was very valued during the process, which I think is part of why it was so successful. It was actually my first time working in Mercer County, and I quickly learned that it was a very needed service, particularly in Trenton, where the population is so diverse, of a growing number of immigrant families and a large population of people of color. And it has been a very rewarding experience being able to assist these families during such a vulnerable part of their lives. It is also important to note that we have here other staff that were part of the pilot since the beginning, who have stayed with us and are committed to the same outcomes as everyone else here. And for any new mom or any moms that are considering the program, I think it's important to know that whether it's your first child or your third child, whether you have Medicaid or private insurance, it doesn't matter. All moms need support during the immediate postpartum period. And that's what's so wonderful about the program. It's that it's universal. I think that's not very common to see, especially when you look at other home visiting programs. The universality of it is really what is going to be a game changer, I think, to understand that everyone could use the program regardless of income, regardless of insurance status. And our nurses really touch on every single aspect, things that moms don't even think about. And the current climate is very difficult for families with newborns, right? The after effects of COVID, increasing inflation, little to no maternity leave. And I feel like we need the service now more than ever. Thank you.
I just want to add that I believe that the Burke Foundation is here today, and I just want to say that I can't see anybody, so I apologize. But I know that the Burke Foundation funded our pilot in Mercer, and absent that, we might not all be sitting here today. So thank you so much for that and for your continued support. Okay, so Catherine, you are going to get our next question. As a nurse, what made you decide to become a nurse home visitor with Family Connects NJ? And can you just walk through a typical visit, how that unfolds?
So I became a nurse for Family Connects in July of last year. Prior to that, I was working bedside at Robert Wood Johnson. I have a degree in public health, and after college, I didn't have the opportunity to work in my degree field. So when I heard about Family Connects, I thought this was a great opportunity to be a public health nurse, which was my long-term goal. Definitely making a difference in the life of mothers in the community. I've actually had an opportunity of experiencing a loss in my family after postpartum delivery. So I was fun to definitely be a part of an in-home service where I'll be able to educate mothers on how to properly take care of themselves, their children, and their family, and definitely be able to give them resources in the community that can help strengthen their family dynamic. In our regular home visit, we make sure that we let the mother know that we're not able to give any information out without their consent, making sure that it's confidential, allowing their family to be a part of the visit as well, grandmothers, fathers, and other family members in the home, providing a maternal assessment for the mother, so doing a full head-to-toe assessment, making sure that the mother is feeling okay. If she needs any more resources as far as scheduling a visit for her doctors, I'm able to do that with her as well in the home setting. And also doing an infant assessment, making sure that we're doing a full head-to-toe assessment on the infant as well, asking the mom if there's any questions that she has in pertaining to her health or the health of the baby. If so, if they don't have any insurance or Medicaid or any other resources, I'm able to sign them up for those things on the spot. And being that I have opportunity to speak with healthcare providers, I'm most likely able to get in contact with somebody on the phone if they're not able to do so as well, so they're able to get that support at the bedside. But I've heard a lot of good feedbacks from the moms. They're like, where was this program when I had my first child? And we just like to let them know that they're also able to have up to three services if needed. So we're able to go back in the home and provide follow-ups for the mom just to make sure that they're able to get resources, access to the resources that I provided. Just educating them on how to be able to take care of themselves, properly breastfeeding, helping them with emotional support, especially postpartum depression, going through some screener questions and just seeing how they're doing emotionally after having their child. And if they get a score that just signifies that they're not doing so well emotionally, we're able to provide them with some emotional support as well, especially for first-time mothers. So all the resources that we're able to have in the community has been very impactful for the mom and the family, especially the baby as well.
I hope that moms will understand that the assessment part is to their benefit. That all we're trying to do is offer support and not be invasive. And I love that the way you described that. It sounds like they're happy, so that's great news. So our next question is for Mara Carrillo. Can you explain your role as a program support specialist for Family Connects NJ, and also share with us the variety of the support that you offer?
Yes, thank you. I'm Mara Carrillo, and I'm the Program Support Specialist for Family Connects Mercer County. I was part of the pilot, and it personally has been a great experience. So I get to talk to families and invite them to receive the service. And I also, so that's the first part of my work. The second part is to call the family after the visit. And in this part of my job, I ask families if they received all the resources they were given in the referrals, and could they connect. And when they can't, I either send them back to the nurse or connect them myself if that's something that I can do. Also, I get to, let me see, I'm sorry, I get nervous and then I need to read. Thank you. Sometimes they can't reach a referral for different reasons. So I connect them with the nurse or the service itself. Other times it's a different resource they need or a different type of question. So I, again, find that resource for them, either through Connecting NJ or through the nurses or for things that I know and relationships I have created in the community. So we make sure that moms have the resources available to them. Even many times language is a big barrier, so that's where my being bilingual comes in and helps. And I have received many comments in this last call I make. For example, that Family Connects helps a lot. I had never had a nurse explain things to me this way. I felt really cared for. I am more confident about taking care of my baby. It was a very nice experience. Another one, if I may. Family Connects is a beautiful option for any mom, even more if you leave the hospital with a depression. I didn't know what depression is. I had no feelings for others, but I am well now. It is so helpful. It is so good to have an in-home visit by a good nurse instead of having to go back to the hospital. And if I may, a last one. Accept the Family Connects visit. They help you. My nurse left me a packet with a lot of information. She told me of birth control too. It feels so good to be cared for. You guys are checking and asking us if we need something 3 months after the birth. It really is a great feeling. I'm very thankful for your service. Thank you.
Incredible. Thank you so much. Now we're going to turn to our legislators, and I'm going to start with Senator Ruiz. You have been an incredible champion for universal nurse home visitation and one of the sponsors for getting this legislation passed. I wonder if you can share any thoughts you have, and particularly how moms might be impacted.
Good morning, everyone. I just want to take a moment to, again, if you'll join me in giving a round of applause to these three phenomenal women who are really doing God's work in this space. And not to lose sight of that as we prepare these programs, there are things that have to go alongside of it, making sure that we're diversifying all professional roles so that when there's a mother who's experiencing something, they see someone like Catherine that looks like her, that they can connect to, that they talk to somebody like Mara in their own language, and that they feel safer in those spaces. So while this is one component, we still have to shift gears and make sure that all those other cylinders are working, right? Making sure that we're elevating all of our Black and brown students so they can be in these spaces to provide the services that we're talking about. The Nurse Visitation Home program for me was born out of personal experience. I have been in the legislature for 16 years now. And the one thing that I will tell you that New Jersey has done, I heard you, Janine, I'm not that old. She was, the one thing that New Jersey has done well for a very long time, and I want to give kudos to that program, is the New Jersey Family Partnership Program. And that's been in existence for a long time. And anyone who's had the opportunity, I've been fortunate enough to go to some of these. They're called graduations. A nurse was always partnered with a family from when the mother was expecting until the child turned 1. And then they would have these graduation services, and I would start crying because everybody would start crying, and it's because the nurse became part of the extended family. And I remember standing there at these events and saying, what if every woman could have this experience? Fast forward to 2016, I'm fortunate enough to be with child, and I am educated. I speak English. I have a partner at home. I'm employed. I had private insurance. I have a great support network from friends who had been mothers. But any person who's brought an infant home, doesn't matter if you have a doctorate degree, doesn't matter if you're a medical professional, you are completely overwhelmed during that time frame. And I had made a commitment to myself that if I was going to do this, I was going to go all in on breastfeeding. That was something that I had, a personal decision I had made for myself and was really laser focused on it. But anyone who knows that in those early days, you really don't know what you're doing. And then I wasn't sure if I was feeding her enough. You just have all these questions outside of everything else that's running through your head, right? Checking how the poop looks. It's just a barrage of stuff, and you're learning time on task at the expense of yourself and sometimes at the expense of the child. And so because of President Obama, actually, that had expanded some of the resources available through private insurance, I was afforded a nurse lactation specialist to come to the house. And she came over, and we stripped Silver down. It's this very precise weight scale. She weighed her, and then she said, go ahead and nurse her for some time, and weighed her again and said, you fed her a couple of ounces. Now, anybody knows that during that time frame, to do that is a superhero power in and of itself. But just knowing that my body was doing what it was supposed to do and that she was receiving what she needed just alleviated this sense of pressure from me that was extraordinary, which led to 4 years. I nursed my daughter for 4 years. And it was, again, I could have researched all the materials. I could have called my OBGYN on her cell phone because I had access to her that way. But nothing changed my trajectory like in that moment and in that space. And again, here we were, still 2 slivers. The Nurture Family Partnership Program, which encompasses one socioeconomic group, right? You have to meet certain economic statutes, and then someone who had private insurance and has accessibility. What about all the people in between? And so that's when we really started talking about what if they could just have one visit, let alone now when the program regs up to 3. And the goal here is that I hope that this becomes just common practice. We go to the OB before we go into delivering those final stages. As everybody knows, there are specific events and dates that you have to see your doctor if you're following that whole trajectory that's afforded to you, that this becomes part of that. That this 10th month, 11th month, 12th month is still seen as the whole cycle of bringing a human being into the world. And, you know, Oregon did beat us, but I will tell you that it was because we drafted the bill, and for whatever reason it laid flat in New Jersey for some time. I want to blame COVID. And I remember having that, the Zoom meeting with the reps from Oregon and said, don't worry, I know you beat us, but New Jersey's going to do it much better, and we will be the national model. And so I know that we're on our steps to do that. But the most compelling thing for me, as proud as I am of working on this, both from a lens of being the only woman in New Jersey Senate to have given birth while in elected office, which speak volumes. And that's why we have to be in all spaces, all of the time, because our lenses and our views really impact how outcomes are delivered, all puns intended. It was when Governor Murphy signed the bill at it was the Urban League, was it, in Newark? And there was a woman who was sitting to the left of me. So meanwhile, I you know, in the whole time that we're working on this piece of legislation, I'm still focused on the child, right? Oh, make sure they're feeding, make sure they're getting access to all of this. And it wasn't until that woman who was part of the nurse family program, she had a toddler who was about 2 and then an infant. And she said if it were not for the post-visit from the nurse who identified that she had post-hypertension, preeclampsia, and the levels were so elevated, she would not have been at that bill signing herself. And then I said, yeah, we're taking care of both individuals, right? The giver of life and the person, because still through the lens of a mother, we drafted this policy, and I was still losing sight of the care for myself. So having that person with the medical experience, with access to what benefits and resources and program, coming into the home, right, where you don't even have to go outside or make an appointment or do any of that, just to check in and say, are you okay? To take a look around, because there are things that you'll notice. Is there food in the refrigerators? Does the house look tidy? Are they living in a safe space? I mean, these are all the elevated things. How about the simplest of things of how are you feeling in general? And just to be a part of this process and really just have it roll out in its first stages, I just look forward to the day when my daughter gets her visit in New Jersey, and that I'm alive to see that the work that we've done today will impact generations to come. We're doing a lot of things in New Jersey that are helping move the needle to protect women and infants, but I can guarantee you that this bill is a game changer.
And it wouldn't be without you, so thank you. Two quick things. One, I can assure you that when Phil and I brought our first, second, third, and fourth child home from the hospital, we literally thought that the hospitals were being negligent letting us out of their big children. We didn't know what we were doing. So it's really reassuring to know that others will benefit and we can pay it forward. And secondarily, you know, we may be the second state, as the senator has just said, but the fact of the matter is we are better for that, because where they have fallen down in Oregon, we have been able to fix pieces of the legislation that they did not attend to. Similarly, we were not the first to have a strategic plan and decide that we wanted to move forward here in New Jersey in this space, but we certainly have the best strategic plan because we've looked at best practices across the country. So we're just better. We're just better in New Jersey. That's all there is to it. And with that in mind, I want to turn to Assemblyman Spate. You have sponsored so many pieces of legislation for infant and maternal health, and I wonder if you can both explain how you feel that this has been building on one another to help our state become the safest place to deliver and raise a baby, and also how your personal experience played into it.
Thank you so much, First Lady. One thing I have to say is this piece of legislation, having 4 children, I'm trying to see, should me and my husband start all over again? My youngest is 18, but I just wish resources was available like this when I was having my children. Over the last several years, working with my colleague and my friend and my sister, Senator Ruiz, we have been working in this space to make sure that maternal health outcomes are better for the people here in our state. And just being a black woman in this space, I remember times when the 4 times I came home after delivering a baby, feeling disconnected, feeling alone, not sure who to talk to, and then you also embarrassed about how you may feel. And then if your body is going through changes, you're thinking that is normal. So oftentimes you have mothers that's home alone, either suffering from postpartum depression, thinking that this is okay and it's normal, or something may be going on in their body and they think this is just a part of the postpartum and suffering basically alone. One of the things while working with Senator Ruiz and having children, and being a black mother of 4, I understood going into a hospital and understanding like the racial disparities and understanding that when I go in that hospital, I'm black, are they going to see me the same way, right? And understanding that I wasn't provided the access, nor the resources, nor the support when I left home, when I left that hospital with my baby. So oftentimes legislation like this, it comes from personal experiences that you may have. It comes from raising your children. It comes from the network that you're around. It comes from your sisters, your family members, and just the people in your community. One of the things is, and it hits home for myself, and when Senator Ruiz started doing this legislation, one of the things that I will always think about and always know is that my husband's mother, when she gave birth to him at the age of 18 years old, and later was released from the hospital, and days later she passed away. If a program was available like this, would she still be alive today? So this program definitely gives me hope, and also knowing and telling the community that postpartum care is just as important as prenatal care, because oftentimes we get prenatal care and you're overwhelmed with caring for your children at home, and you're like, I'm going to forget this visit, not knowing that your body is going through something that it shouldn't be going through, and you miss that visit, and possibly you can lose your life. And so knowing that postpartum care can actually save a life, I know myself and Senator Ruiz will continue to stay doing this work and making sure that we advocate for people in our communities that don't have a voice. So thank you so much for being here.
Thank you, Assemblywoman. Just to underscore, 52% of these deaths occur postpartum. So this is truly a game changer, and really thank you for sharing all that you do. So the last question goes to our incredible Commissioner, Christine Norbert-Beyer. I would just say that Christine and her team are almost giddy on the one hand, and on the other hand, they are literally crying about this program. And Christine, I think I just hand it off to you if you can talk about how this builds on all the work that we've been doing through Nurture NJ and Department of Children and Families.
Thank you. Yes, we are giddy, and I have a few team members here with me. If you guys will wave in the back, our Deputy Commissioner and Assistant Commissioner and administrators who really are, I will say, in addition to the legislature and the First Lady, the reason that this program is existing right now. So, yeah, thank you. And I'll just say it's also hard to follow all those testimonials, because that is the reason, all of what you heard is the reason we're doing the program. And so I'm going to ask or share why Family Connects, a little bit more about the nuts and bolts of the program. And as the First Lady said, this program continues New Jersey's trajectory to become a national leader on maternal health through the First Lady's Nurture NJ initiatives and the work happening at DCF and other departments throughout state government to support families with a host of prevention-oriented and family-focused services. Family Connects NJ is positioned to change the way that postpartum care is delivered to families across New Jersey. And once fully implemented, every family caring for a newborn in New Jersey, including birth families, adoptive families, resource families, kinship caregivers, as well as birthing people recovering from a stillbirth or neonatal loss, will be able to request a free and voluntary visit from our specially trained nurses. And as you heard from the nurses who are delivering this service, nurses will assess the physical and mental health of the caregiver and the physical and developmental health of the infant, answer questions that the family may have, and connect the family to other needed resources in their communities. The Family Connects model, and why we chose this evidence-based model, has been shown through randomized control trials to be associated with reduced child maltreatment, greater community connections, improved maternal mental health, and significantly more positive parenting behaviors. Within the context of the First Lady's Nurture New Jersey strategic plan, the adoption and implementation of the Family Connects model of universal home visiting supports the plan goal of strengthening and expanding public policy. And as Senator Ruiz said, we still have a long way to go, but this, I think, is a game changer, and it will be life-saving. In other jurisdictions, we talked about Oregon as the other state, but there are other jurisdictions throughout the country where Family Connects has been implemented. Families experienced 50% fewer emergency room visits in the first year of their baby's life because they were better able to maintain their health by being connected through the Family Connects program to a medical home or a primary medical provider to meet their family's ongoing needs. The Family Connects model allows for up to 3 visits. Our legislation allows for up to 3 visits at a home by a registered or advanced practice nurse, but in partnership with community alignment specialists in the Connecting NJ hubs. Those visits become an amplifier of existing programs, including other DCF home visiting programs, as well as WIC benefits. We heard about the nurse's ability to help families sign up right in their home, as well as other benefits that are offered through the Department of Human Services. Because Family Connects NJ is available to all families statewide, regardless of income, insurance status, or immigration status, we're able to address long-standing issues of racial disparity in birthing outcomes by building trusting relationships with communities of color who may be more willing to accept help from a registered nurse than they would traditionally be comfortable receiving services from government. Additionally, Family Connects NJ benefits from efforts championed through Nurture NJ to promote and develop a representative community workforce supporting pregnant individuals and babies. When the nurse at your door knows your community and is from your community, that's a powerful endorsement and a reassurance for families who may be reluctant to invite a stranger into their home. Family Connects is a valuable extension of the existing network of supports for new moms, families, and babies from community-based programs, our state-supported initiatives, and a family's own chosen healthcare provider network. It's a key component in building the foundations for the postpartum health system of tomorrow and opening the doors for families to connect to other programs available through Nurture NJ and our sister state agencies. So at DCF, we really are very proud to partner with the First Lady, with our legislators, with our nurses and our providers to launch this exciting new program. When I became the commissioner in 2018, we were sitting, I think, in my office, myself and Deputy Commissioner, talking about home visiting, universal home visiting, what a game changer that would be if we were able to bring that to New Jersey. President Obama had a task force on how to reduce or eliminate deaths as a result of maltreatment. And one of the recommendations was universal home visiting. And so that was kind of the lens that we at the department started to look at universal home visiting, and then partnering with all of our healthcare providers and our legislators and the First Lady's initiative around maternal and infant mortality and morbidity. It was like the perfect storm that it all culminated in why we're here today and releasing this program. So thank you so much.
First Lady, can I just, because I would be remiss, legislators are really good about coming up with a lot of ideas. And it is critical to have a partner in an administration that is aligned with those moral missions and beliefs that we have, and a department that painstakingly labored in this process to be sure that the rollout would be seamless and that they were very responsible. I remember, you know, we're going to take a little more time, but very responsible in making sure that the feeder program is there, because you are tapping an industry that's already taxed, nursing, right? And so the commissioner was keenly aware from the beginning, so a debt of gratitude into your entire team. Congratulations.
Yeah, and I will piggyback on that and just say that I am incredibly optimistic about where we are and where we're heading as a state. Since Phil came into government in 2018, working together with the legislature, he has now signed over 60 pieces of legislation in this space, and I'm so thankful for everything that the legislature does and working with all of us, because this has been, New Jersey's on a roll, and I'm so proud. I'm so happy. So for that, I want to thank the entire panel, as well as the thousands of advocates and supporters for joining us on this important and life-saving mission. Please help us get the word out today that every new mom and adoptive parent in Cumberland, Gloucester, Middlesex, Mercer, and Essex counties can learn more and sign up for these visits today at FamilyConnectsNJ.org. I want to give a shout out because we have some partners here today who did not have a speaking role, and I want to make sure that we know the diversity of those who are engaged in this. We've got Planned Parenthood here, so I thank you for being here. We have Garden State Equality in the House. Thank you. We have the New Jersey Puerto Rico Commission here in the House. So, and to all of the members of my team, as well as the Office of the Governor, thank you all for your help, because we couldn't do it without you. So Maternal Health Awareness Day is but one day out of the year, but it offers us an opportunity to raise the volume on our rallying cry to transform New Jersey's maternal health landscape. At the beginning of our roundtable, I shared that our Universal Nurse Home Visitation Program was launched on Martin Luther King Day. And I want to close by sharing another of the Reverend Doctor's ideas. In his The Other America speech, Dr. King said that his work for economic equity was to ensure that all children grow up in the sunlight of opportunity. I believe that vision must include the opportunity to simply be healthy, and that is what our work is all about. Ensuring that every mother and baby in this state begins life together in health and joy. And together, step by step, program by program, budget by budget, and piece of legislation by piece of legislation, we will get there. We will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. With that, thank you all for coming. All right.